to all of you. Apologies for starting slightly late, but we were waiting for colleagues from the department building behind us to join us. So I would like to welcome all of you to this special seminar and exhibition that we are hosting as the Division of Occupational Medicine. And the theme for this afternoon is entitled Asbestos Blues and the Politics of Silicosis in South African Gold Mines, with a special tribute to colleague Jock McCulloch and his work. The unexpected death of Jock earlier this year from mesothelioma prompted a number of us to reflect a little bit about what's happening, and also to refocus our energies to the current challenges of the day, and especially in relation to exposing the global environmental disaster caused by asbestos all over the world, and what the implications are for both workers as well as communities in relation to the aftermath of asbestos mining and its use. Jock was a professor of history at RMIT in Melbourne, and he was one of the foremost historians who dedicated his life to exposing the hazards and the risks and the uses and the politics around asbestos and its movement all over the world. And he played a pivotal role in exposing and increasing awareness around the psychosocial aspects, the political aspects, the economic aspects of asbestos use and mining. And he's increasingly in later years, he also began to focus on the next scourge that is now on our doorstep. And this is the scourge of silicosis and TB that has been caused by mining, especially in the gold mines in South Africa. So while asbestos mining and manufacture has been banned since the late 1990s, the effects and the socio-economic consequences and the environmental consequences of asbestos still sits with us today. And a number of us review medical claims for occupational or environmental disease, and almost every second week there's a new case of mesothelioma that presents to us to evaluate or to assess. And it is no coincidence that with Jock's passing away just recently, about a month ago, a groundbreaking class action suit was successfully negotiated with the gold mines and on behalf of workers and communities who may have had silicosis and or tuberculosis. This is, as some folks mentioned, the largest class action suit in South Africa, and one which will have major implications for up to 100,000 ex-gold miners who may have contracted silicosis and or TB. And the value of this particular class action suit is set at around 5 billion rands. Various studies in South Africa over the years have shown that at least 20% of ex-gold miners have silicosis. And if one has to add the issue of TB to that, then the figure climbs to at least 1/3 of ex-gold miners have TB and or silicosis. Most of these workers reside in the rural areas of the Eastern Cape, in countries like Lesotho, Mozambique, and where the infrastructure for health services are very poor, and for which the public health system has to rely on to assess and to assist these workers. So it gives me great pleasure then to introduce my colleague, Dr. Sophia Kisting, who will hopefully enlighten you more about the issues that I've just mentioned, and also to open this exhibition in memory of Jock and his work, which we thought would be a fitting tribute. So just to mention a little bit about Sophie, as I wrote this, it brought back many memories, at least a 20-year association with Sophie. And over this period, we have obviously learned a lot and gained from each other. Sophie is an occupational medicine specialist, and she is the current Executive Director of the National Institute for Occupational Health, which is the center in South Africa looking after the health of all workers in this country. She played a seminal role in the International Labour Organization recommendation for HIV and AIDS in the world of work, which she presented to the United Nations General Assembly in 2011. Sophie has a rich history working in the public health system and promoting capacity for public health for over 20 years in various regions of the country. And she also specifically coordinated the WHO and ILO joint program for its global effort on occupational health in Africa. She played a key role in the development of the partnership for the global program for the elimination of silicosis, and also played an important role in the in the Parliamentary Asbestos Summit, which was held in 1998. In 2003, the Journal of Epidemiology and Community Health in the US recognized her as one of 10 influential women in occupational health and safety internationally. She is currently the chairperson of the Quebec Trust, which is a precursor of a lawsuit which was aimed at compensating workers with silicosis on the gold mines. And she will be one of the trustees of the newly formed trust, which is now going to be set up to address this class action suit in time to come. And more recently, Sophie was awarded the UCT President of Convocation Medal for 2017 for her socially responsive and engaged scholarship and advocacy in the field of health and championing the cause of the social, economic and labor rights of workers. So it gives me great pleasure then to call on Sophie to deliver her.
Thank you very much, Mohammed, and I hope you can all hear me. It really is such a joy and a pleasure to come to UCT. I was saying to Mohammed earlier, it kind of wants to bubble out of me that I really love this university. You want to say, I wish we could make everything right within it. But before I get to the program of the day and the reason for me my address, I need to tell you a secret. I have a photograph where Mohammed is toying with a group of workers. And the real toy. We went to a Soli mine. We went to an asbestos mine. And the workers were demonstrating. They did not want us to leave the x-rays that were done by the company. They wanted other x-rays. So they were demonstrating against the company for these new x-rays. And of course, Mohammed and I and our team of the NUM workers and so on had to convince them that it depends on how we read it. In those days, we were reading those x-rays at night, even with a generator. And Tony Davies at one stage also came to read it with us and so on. And in that process, we joined the toy. And Mohammed was absolutely the star. I was hoping to find the photographs. Don't worry, we will circulate it now. So having said that, it's just, we worked so much together in asbestos, and so many of you right here in this room, we did that work together. Raj and Shakira, Pfizer, who's passed on, so many others. So, my dear colleagues and friends, today we are here together to pay a tribute to someone who is very, very important in occupational and environmental health in South Africa. But because the subject that we are dealing with is of such emotional and social and historic import, and because in both silicosis and asbestos we have lost so many people who cannot be with us today, including Jock McCulloch, who died of mesothelioma, I would like us just to stand for half a minute to remember those who have passed on globally from asbestos and silicosis. Stand.
Sophie, can you speak up just a little more, a little louder, please?
I'll just have to time, please, Mohammed, one of you, and tell me when I'm out of time. So, we are gathered to honor, remember, and pay tribute to one of the most significant supporters of social justice within the occupational and environmental health field. He was not a medical professional, but a historian. Professor Jock McCulloch, as Mohammed said, was a writer, an emeritus professor of history in the School of Global, Urban and Social Studies at Royal Melbourne Institute of Technology, of course in Melbourne, Australia. He was a great and trusted friend of the people and especially of the workers of South Africa. Jock was a son of the soil from Australia who died on 18 January of mesothelioma, as you will all know, a cancer of the lining of the lung caused by asbestos. That is the only known cause we have for mesothelioma. He was diagnosed with mesothelioma in April 2017 and indicated very clearly before his death that the only source of exposure to asbestos was in South Africa about 20 years ago when he was doing research for his book, Asbestos Blues. What an irony of history for a historian. And I will come back to talk a little bit about Jock's works. Jock's PhD thesis, most remarkably, was on Frans Fanon, a medical doctor from Martinique in the West Indies who specialized in psychiatry in France and then worked in Algeria during the Algerian Liberation War against French occupation. I cannot help but remember during the feast was called struggles of our students in recent years, we so often heard reference being made to the courage and the psychosocial impact of the work of Frans Fanon. Two of his books, Black Skin, White Masks and The Red Shirt of the Earth, remain sources of great analysis and intellectual inspiration of the human condition. It inspired students now, and it sustained many of us during the dark days of apartheid. This fact that Jock's PhD thesis was on Frans Fanon and his work explained to me so much about Jock's deep understanding of the South African psyche, of the social and political landscape shaped by colonialism years and years ago, legalized racial segregation and enforced inequality. Jock is a young researcher in the parliament in Australia, also worked for a time amongst the Aboriginal people in his country, and he wrote about the devastating physical and psychological effect of Agent Orange, a herbicide, used in the Vietnam War, and of course it had a major impact on Australian war veterans, like it had on American war veterans. So Asbestos Blues, which is this book, and of course play on the fact that Jock did his research along the blue asbestos belt in the Northern Cape of our country. It's about South Africa's croxidolite asbestos mines and was published in 2002. And Jock dedicated the book to Dr. Pavla Miller in Melbourne and Professor Tony Davies in South Africa. Pavla is Jock's long-standing partner of many decades, and Tony Davies is a former executive director of the National Institute of Occupational Health, where I currently work. Tony Davis is also one of those who led the exodus of us, so we went through that toy process with less engagement. Tony has made a significant contribution to further our understanding of the legacy of asbestos use, but in particular his determination to focus on the importance of lowering silica dust levels in the gold mines of South Africa. And we owe him great gratitude. He is too unwell now to travel concerning industry. Jock met Jeffrey Tweedale, a close friend of his, at the Osasco Asbestos Conference in Brazil, organized by Fernanda Guianassi, who is an asbestos activist in Brazil, and also Laurie Payson Allen, who runs the International Ban Asbestos program. Jock and Jeffrey wrote the award-winning book about asbestos, the asbestos industry, called Defending the Indefensible. This book was informed very much by the realization that most of the world's asbestos were mined after 1960. And why is that significant? Because mesothelioma and its link to asbestos exposure, that link was known, well known by 1960. And it was South African, Dr. Hartman, who actually made that link based on research work in So that realization inspired that book, and that book won a major award internationally. How was this possible after the world learned that asbestos could cause mesothelioma, even in persons with only mild environmental exposure? This jointly authored book set out to answer the question by exploring the sophisticated and mostly untransparent ways in which the asbestos industry had exploited facts to continue to make progress. Jock's partner Pabla indicated the following: until late in the year, Jock was able to work on the manuscript of gold mining, migrant labor, and corruption of scientific knowledge in South Africa. That was Jock's last work. The book is unpublished but finished, and I'm sure will be published soon. She worked on this manuscript with Jock and described it as another lasting testament to his remarkable contribution to historical scholarship and the fight of workers and communities for justice. Leslie London and I were the guest editors for a special edition of New Solutions on the extractive industries. We were the guest editors. And Jock submitted a paper that came out in 2016. And in there, Jock also really grappled with this issue about the corruption of science. How is it possible that researchers can be paid to distort scientific information in order to say a substance that's toxic is actually safe? It's that big debate that I think we must think about and we must learn from. And for me, that's one of the biggest lessons, because nobody has ever, I feel for me, put it in that very blunt way to say it is possible for science to take the wrong side. It is possible for science to be subjected to influence by industry, like tobacco, asbestos, these kinds of things. So we have to be mindful about it. We who work with students every day and work with workers every day who are sick from work. So Jock was honored posthumously with the 2018 Dr. Irving Salicoff Lifetime Achievement Award for his dedication to increasing awareness about asbestos and for his outstanding contributions to exposing the psychosocial, political and labor abuses of the asbestos trade. His partner Paula said Jock recognized that the key to ridding the world of asbestos involved an international effort against a ruthless global industry. And I think that's how Jock felt. Like I'm sure so many of us who have struggled with asbestos work over so long a period, that you're up against something so powerful that sometimes you just feel helpless. One of the things that Jock wrote about too is the position of women in the asbestos mines, and I want to focus on that because so much of my work in occupational health really relates to the difficult position that women workers find themselves, and I hope, like Jock, to always profile their position and the different exposures and outcomes that they have. So the tragedy for women and children who work with asbestos mines is that most cannot prove they engaged in a risk work, so they are not entitled to compensation. So you see, in the NIH postmortems, the diagnosis of POS, and they are women. They are steadily women. A number of them, the vast majority of them, post-mortems, cannot be compensated because they cannot demonstrate that they have done any risk. You see, they have worked. You see. So it's a way that women's work is so often viewed in a manner that what they do is just the same as the housework. So it's a hobby and things like that. There is currently no compensation for environmental mesothelioma for those who are environmentally exposed to asbestos chemicals. I want to raise this as something very, very important because given that asbestos is the only known cause of this deadly cancer, all cases of mesothelioma should be considered. And we in the occupational environmental health sphere, we should advocate for it, we should fight for it, we should put it forward because it's another issue of social justice that is being overlooked all the time. And it won't even be that when you find an analysis. I mean, mesothelioma is a common cancer in South Africa. But the numbers are not going to be staggering that it's going to break the compensation fund since there are billions sitting there that's not paid out to workers. So in the quest of social justice, I want to, in honor of Jock says it's one of the things we should take forward. It will be a small measure of social justice and will also help. Then the second book that Jock wrote, third book, is South Africa's Gold Mines and the Politics of Silicosis. Yeah, so it's exactly the name of the book. In the book, he revealed how the gold mining industry, in collusion with a minority apartheid state, was hiding the epidemic of silicosis and tuberculosis for the better part of a century. And you know I can say this about the books, but I urge you to read them. Could I ask you to read them for yourself? Because it is a foreigner, a son from another country who came here and wrote books about our own history in a manner that has certainly taught me so much about our history and helped me understand things from another perspective. It's an objective perspective, something coming from outside. It's not one of us who've grown up here. So it's a different kind of objectivity. So I really, really want to urge you to get hold of these books and to read them. It tells us just so much about our own history that we just don't know. And it's meticulously researched with documents from our archives. You know, we love the documents. Finding the documents, finding the sources and interpreting them in a way that makes sense to us. Not because it's a question that we want to divide or apportion blame, no, but so that we can find ways to speak the truth to power. And when we have the truth, we can find solutions to it. Because I think that's what we have to do when the situation is so big. Mohammed, so silicosis, silica dust predisposes tuberculosis. Am I right? I understand there's a lot of doubt in our minds about it. I don't want us to have doubts about it. We see the reality. And we go back and trust where Mohammed then was trust, where I think we probably have seen now over 2,000 workers exposed to silica dust and TB. I suppose the biggest lesson is just how much TB there is. Sometimes you can't even read the silicosis of somebody who's worked there for 30 years underground. So Jock, taking on the issue of silicosis and tuberculosis, I think it's a very important one for us. And so, just as Mohammed indicated, about 2 months after Jock died, on the 3rd of May, there was this huge settlement in Johannesburg. On the 3rd of May 2018, a historic event took place in Johannesburg, in Igoli, in that city of gold. There was an announcement of a settlement agreement between 6 comfort mining houses and lawyers representing workers sick from silicosis and tuberculosis. Our Minister of Health, Dr. Aaron Matsuonedi, was present. So was Richard Spoor and his team. So was Janet Love and the team from the LRC, the Legal Resources Center, who worked on silicosis. Richard and Janet worked on silicosis. And then there was Charles Abrams and his team who worked on tuberculosis. The inclusion of tuberculosis is truly historic and very significant. And we need to thank Charles Abrams, son of Bishop Lavis on Cape Flats, for his absolutely dogged determination and dedication to the cause of workers suffering from TB following exposure to silica dust. Charles, I've just noticed that you are. Stand, Charles. Yeah. So Charles, I can only say that Township Boyke is still there. So it was a significant settlement. It was, I was there. And it's almost like you cannot believe it's happening. It's almost understated. It's almost like you're walking around history of the settlement. The only big downside for me is that the mining houses seem to have really insisted on linking the payment to workers through the existing ODMWA system, which we know is not functioning optimally. So that is a challenge, and will be a challenge for all of us in the occupational environmental health industry, because this is enormous. Think of 100,000 workers in Southern Africa. Charles, I don't know how you folks did it, but I mean, it's just so many. It's going to occupy everyone in the occupational health field and beyond. But of course, it will only remain settlement, it will only remain a trust in name unless we continue to struggle to ensure that the money gets to the workers. Because the question of the compensation of the workers, especially those in the gold mines and other mines and so on, the compensation of the workers who are sick from work-related diseases, I think remain one of the biggest social justice issues of this country. It really is that. And so the most important step forward will be to get the money into the hands of mine workers and their families. And this is where I think the broader occupational health fraternity can help enormously. This will require determination, courage, and an inclusive approach where we need to live the words of one of the greatest leaders of Africa, Amilcar Cabral, who said, "Tell no lies and claim no misfortunes." We cannot say that the money is with the workers if it isn't with them. And I think we have to find the ways. Through the Kubeka Trust, we have shown we can get the money to the workers. Irrespective of how difficult things are, there is always a way to find a way to get the money to the workers in far-flung rural areas, and to do it in a way that's transparent and open and dependable and repeatable. Should South Africans fail to get the money to the workers in Southern Africa, whom history has disadvantaged in such a cruel manner, then history will most certainly not absolve us. It's a chance for us to do it and to hold accountable those who agree to get the money to the workers. We need to find ways to hold ourselves and everyone else accountable after all this enormous work and this negotiation that Charles then engaged in. It is incumbent on us who have learned from Jock and others and who know the suffering of the workers to continue to research, to organize, and to build unity of purpose across all barriers to prevent current mine workers from getting sick as we move forward. And I think Mohammed and others here will agree with me that we are worried about the workers who are currently still working, because we know that the silica dust levels have not really come down. So the chances of still getting silicosis, of still getting tuberculosis is very real. So it should be an incentive for us to do more research, to get more of our young graduates to do their PhDs and so on, to look at these links and to find ways that we hold everyone accountable to bring the dust levels down. If we can achieve that on the back of the settlement, I think it will really be good for workers everywhere. So this means concerted efforts to reduce silicon dust. Let us, this generation and generations to come, learn from this dark history that we don't want to dwell on all the time, but it's necessary for us to know and understand and prevent a repetition. It can only be done if we work in a transparent, inclusive manner with unity of purpose to protect the human rights of every man and woman within the world of work and within society. And that, as I would have said on another occasion, for me is so important that we have to learn to respect human rights. On the 10th of May, 7 days ago, Thursday, 7 days ago, there was a memorial service for 7 workers who died in the Sibanya gold mine. And you know, I was going about my work and read the newspapers and so many people wait. And Mohammed would know how sometimes we used to go and we work for the Industrial Health Research Group to debrief workers or families whose loved ones died underground. And you think of those families waiting there in the hope that loved one would be turned. It's the kind of story that you can never imagine unless you've sort of lived it and so on. And yet in South Africa we're so blasé about it. So another group of mine workers have died. No, it's another group of mine workers, they died, mine workers died. But you see, how do we really value living life? How do we change that mindset unless we begin to see each other with death? Every death is one too many. Let's see. The work of bringing a measure of justice to those already suffering from asbestos-related diseases, silica-related diseases, and tuberculosis requires an inclusive approach, and many very good people contribute to it. We salute the workers and the organizations, the community members, the lawyers, the epidemiologists, the internationalists, the biostatisticians, the medical professions, and the men and women in the mining houses. And because there are men and women in the mining houses who are prepared to be part of the lasting solution. The lasting solution must go across all financial divisions, across all racial divisions. It needs all of us together, and it's an opportunity. The complementary role played by so many different people of goodwill makes it possible to begin to hope that we are standing on the threshold of a dream that a silica-free environment is really possible. You think it's possible? Yes. I don't hear resounding yes. A silica-free work environment. Just imagine. What a dream. So we can work for it. Let's find the ways to work for it together. I'm almost done now. Here I want to remember Mr. Stephen Kotloana, who is a humble son from Hamopeda village near Kuruman. He was the chairperson of the Asbestos Interest Group. Together we researched in the villages, 16, 17 villages around Kuruman, blue asbestos exposed villages. Researched and put together a paper for Parliament with 9 American students paired up with South African students from different tertiary institutions. Then we did that work together and presented this report to Parliament. And one of the main presenters was Mr. Stephen Kotloana, who is a villager who chaired the Asbestos Interest Group. He tirelessly worked to share information with villagers on protecting themselves from asbestos exposure, especially school children. Stephen died 2 years ago, soon after he presented at the Misohiriyama conference here, that Jim will know. And the AIG continues to operate, and his daughter Prudence assists in taking the work forward. So there are community members that we can engage with more, and there are more research papers waiting to be written. I was thinking about this when Mohammed asked me to come and speak here today. I was thinking about it a lot, because I think I would like to use this opportunity to acknowledge many, many medical professionals who, together with legal groups and other experts and internationalists of goodwill, have helped us in this country to find a way to profile the problems related to the health of workers. When I was first doing my DOH in the early 1990s here, Johnny Myers was certainly my mentor. And I was introduced to a paper that had the most remarkable influence on my life. A paper that Johnny published together with Judith Cornell, John Parrish and others, about asbestos amongst the port workers in the Cape Town harbour, how they asbestos. And it was done with such scientific rigor. And the analysis was so amazing, it stayed with me forever and influenced my work. Now, I'm mentioning Johnny because he was here in our school, but there are so many others that I cannot all name right now. Many of them are in this room here today. Many of them are all over South Africa. Many of them are all over the globe. But I feel so often this group who have, some of them just acquire the highest kind of skills, make such an enormous contribution towards a greater science in occupational health and safety. And I want to acknowledge them. Some of them are acknowledged in Jock's book. Some of them are not. Some of them slog away in the background doing that work, reading that next X-ray, doing that next ILO study. And I want to acknowledge that many people today, because I think very often they are unacknowledged. That group of occupational and environmental health people who make it possible for us to have a better understanding of what's happening. But I also want to challenge that very same group to find a way to do more. Find a way to do more so that we build on what Charles, Richard, Janet, and all of them and their teams have achieved, so that we can ensure that we will understand the link better between silica dust and TB, and we will find greater prevention. So Jock has left us a gift of immense proportions. The very raison d'etre, the very reason for the existence of a university is in part to create and share knowledge in an accessible and equitable manner. In a way, to follow knowledge like a sinking star beyond the utmost bound of human thoughts, in the words of Tennyson. Who better to emulate than those who live for the ideal that our common humanity can be strengthened through shining a spotlight on toxic substances in different continents of our globe that harm workers' health and safety. What then do we do with the legacy of Jock McCulloch as it pertains to the historic documentation of the greater truth? How do we change the way history is recorded and shine a spotlight on the conditions under which workers have to work to fulfill a profit motive? In 2015, I listened in amazement when how a South Korean poet amongst the Samsung and the Hyundai factories and so on, when he said he opened a global conference on occupational health and safety by lamenting the manner in which the profit motive overtook our common humanity. In a sense, he was describing the spirit of Ubuntu we know so well in so many of our countries in Africa. I am because you are. And I think somehow or the other, when the profit motive is uppermost, we forget about the human condition and about our common humanity as a people. We thank Jock and other good men and women for having selected to share their research and love of documents and the rigor of science to help us understand our own history better and help create a gentler, more just, and more equal world of work and society. In a recent visit to Dublin, I note the following quote from Bishop there's room to do because he went there to have discussions for international solidarity, and it said, your ordinary acts of love and hope warrants the extraordinary promise that every human life is of inestimable value. So thank you, Pavla, and thank you, Australia, for having shared Jock with us. As they will say in the asbestos-contaminated villages within the blue asbestos belt, that inspired Jock to write Asbestos Blues. Kelly Bochile Jock, Hambakar.
Thank you, Sophie. It was really a journey of something that you can really appreciate and experience, as Sophie was describing. So Sophie has agreed to have some questions. So we're opening the floor for some questions and exchange. And also, if there are other colleagues who would like to say something, please do. Including Charles, if you want to make a comment, please do as well. Because I'm sure there's a lot of interest in what is happening today, as well as in what happened in the past. Maybe.
Yeah, thank you so much. I wanted to just mention that the worst offenders of asbestos mining have not banned asbestos yet. 55 countries have banned asbestos, but China, Russia, India, Canada, and the United States have not. So this is not going to go away anytime soon. I consider it one of the worst public health disasters. I can't think of anything as equivalent to this as a public health disaster, and community health. I mean, we've had communities completely poisoned in the U.S. where asbestos mining has happened, where women and children and anyone else who wasn't working in the mines were affected, just as has happened here. When I first started working in a clinical role as an occupational health specialist at University of Washington, one of the first things we did was the director, Linda Rosenstock, who became head of our NIOSH, we imported, I guess you would say, the occupational medicine practice of someone who worked with the shipyard workers on the docks in Seattle area, the Puget Sound area. So then we brought all these patients into our practice who essentially their main issue had been working in the shipyards probably since the 40s, the 50s. So part of my job was to interview all these people about their work history, and then it eventually evolved to plumbers and pipe fitters and firefighters and all kinds of people in the trades who were working in these fields. And I probably interviewed hundreds of workers about what their exposure were. And one of the interesting things that I heard from these workers was because they weren't told that asbestos was dangerous and it's white, they would bring it home and throw it onto their Christmas trees. So the families were becoming exposed, and all the women who were washing their clothes when they came home with their take-home exposures. So it's so pervasive, and this is my experience in the U.S. I haven't had the experience here, but I had the pleasure and honor of meeting Jock McCulloch in 2001. He was here. I don't actually remember. He did a talk on his work at the District 6 Museum, as it turned out. I'm not sure which. He might have been researching this book. And anyway, I won't forget what an impressive, remarkable person he was. So, but thank you so much for being here and sharing your experiences and memories with us. This is one of these legacies, besides Jock's legacy, the asbestos legacy. And when you mentioned about the exposures and silica exposures not coming down, we've had a resurgence, epidemic proportions among coal miners in the U.S. For reasons I don't completely understand. How many of us are mystified by this increase in pneumoconiosis, black lung disease. In 2018. So anyway, we have a long way to go. But thank you.
Thanks so much, Mary.
Other questions, comments, contributions? Charles?
Thanks so much, Sophie. I just want to make some very, very quick.
Can you speak up a little, please?
I'd like to make some, 3 quick observations. As Sophie, advised, I'm Charles Abrams, and I've been one of the attorneys who've been working, on this matter for the last, 14 years. When I think back, when we started with myself and Richard Spoor with a single gold miner, the entire industry, both the gold mining industry as well as the legal industry, was of the view that you cannot sue a gold mining company simply because everyone believes that gold mining companies, or in fact mining companies per se, were immune from suit because if you contract occupational diseases, you have to go to one hand COIDA and on the other hand through a DIMWA MBOT because there is a statutory bar. We just didn't believe that, but it has taken us many years ultimately to get to where we are. But 3 points I want to make. One is in relation to Jock. One of the reasons why, unlike my colleagues, we felt as a law firm that there was something about tuberculosis that we needed to pursue, even though the science and the law was against us, was because of Jock. When I first read Jock's book, I was stunned, I was shocked. If I look at the history, particularly of the Mozambican mines, around the time it was called the East Coast workers, and there was initial studies that were conducted, and so on, commissions, and they couldn't understand the why miners came back they went back from South African mines back to Mozambique, and they discovered that there was huge tuberculosis, almost tuberculosis epidemic. And I was so shocked and surprised that medical experts would consistently deny the link between their working in underground gold mines and the contraction of tuberculosis. Except what we came out was, well, you've got to look at the conditions in the kraals, the humidity, etc. Despite the fact that prior to that, TB was an unknown thing. And for me that sucked. But it was also a sense of almost an indictment against the medical scientific profession. That we were prepared to risk almost everything ourselves for the sake of, and I suppose I don't want to take that further, and we have seen that consistently over a period of time. It's been an uphill battle. Second point is, Sophie, Ahmad, all of you, Rajan, the rest, Shahida, and so many more. I don't want to name you by name because there were so many more. We're prepared to stick the legs out. We took on the tuberculotic, or the case on behalf of tuberculosis miners, not because of miners who had contracted silicosis and the sequelae was, the contraction of tuberculosis, but miners who had contracted tuberculosis in the absence of, silicosis. And for all of you, part of my journey, it has been one of the most difficult, most uphill battles, scientifically and also legally. Legally, we know that unlike the causal connection between silica dust and silicosis, that was almost an impossibility for us to rise to the occasion legally, the relationship between silica dust and tuberculosis. But the epidemiology was clear. I mean, if the epidemiology suggests to us that 3 to 5 times, if not more, of mine workers being, having developed tuberculosis compared to that in the general population, then surely there was something. And for us, that was what we're held, onto. I'd like to thank, those who have been prepared to, assist us. The achievement in respect of TV wasn't a great, achievement. We would have wanted more, but the mining companies that insisted that we keep it as. In fact, first TV was not even on the table, and that's why the negotiations took so long. But eventually, with our sheer doggedness and persistence, we managed to carve a tiny bit, in the entire settlement out on behalf of tuberculotic miners. But my sense is that I certainly hope that this is a starting point. I don't think it is the alpha and omega, but at least it is a starting point, for us, both again as activists, lawyers, but more so, you on the medical, scientific side, that perhaps this is an opportunity for us to really, really further engage in these, challenging issues. Then on the issue just of the settlement, it's still going to be a long way. We need court approval, and that's going to be a journey that's going to take us probably for the next 4 months. Hopefully until November, where we can get an approval. And once all those conditions precedents are met, sometime hopefully early next year, we could see the establishment of the trust. But I have no doubt that this is going to be a humongous size. And as you say, the important thing that this trust can only work if it goes out and reaches out to as many eligible claimants. And for that to happen, I think we really need all of your support in making this happen.
Thank you.
Jim Delartner here. I'd like to ask you a question of Charles Adams. What are the likely scenarios where the deal would be scaled?
It's everyone facing back. So there are a couple of conditions that we have. That's what we call part of the conditions precedent, and that is if 2,000 mine workers, eligible mine workers, opt out. Now, some of you might say, well, that's a pretty low threshold. One, in order to be an eligible claimant, you either fall within the silicotic bracket, that means to say the 0 to 10. We call them the sub 10, 10%ers, and all of you, Jim, you worked, on that, which is, those with radiological silicosis, but, for the purpose of the statutory regime, they don't get, any compensation. We know that the compensation to miners, under the ODIMWA regime is from 10%, to 40, which is, lung function impairment, and then 40% higher. But under silicosis, we've got the, sub 10, the, 10, 40, and then 40 up. The same with tuberculosis. Under the current regime, we've got those with lung function impairment of 10 to 40% and 40% up. Okay? That is the general spectrum of how this deal is conceived. We also know that if you look at the compensation under ODIMWA compared to what is, we've agreed upon, in terms of the settlement, they are 2.5 times, up to 3 times more than what you currently receive in ODIMWA. And the reason for that is that we wanted to make this as attractive as possible to a broad body. But there are those who may very well have individual claims that are significantly higher. So this deal wasn't really conceived, for those who, let's say, maybe, a mine manager, that, earned a significant amount, and it's very, very young, contracted, either silicosis or tuberculosis, etc., and who could potentially claim a couple of millions. This deal was not really aimed at benefiting that group. This deal was aimed at benefiting the broad strata of ordinary, current, and former mine workers. So those who would potentially opt out would be that category, but then they would be in a position to afford lawyers, etc., unlike a miner who would be in the Siki or somewhere in the Ponderland, etc., who just simply does not have that ability. So that would be, the potential. other would be, of course, it depends on, if the court, deems this, unreasonable, which we doubt, because we have really, really gone through, a very, very long process. So I think the only, basis for this deal to be scuppered, if there are what we would call more than that 2,000, miners, opting out. But then again, it is also as to whether the mining companies, because it is at the election of the mining companies, whether they will accept that as, a condition which would scupper the deal, or notwithstanding them opting out, they will still continue.
Other comments, questions?
Jock. I just want to have one comment. I was asked to present the paper.
Maybe you want to come in the front spot and everyone can hear you.
I was always my colleague and sister at the National Institute for Professional Health. Sophie's my boss. So I have to oblige. So I was asked to present a paper on the state of asbestos and asbestos-related diseases in Africa. And I just wanted to make people aware that in South Africa, asbestos was banned, asbestos manufacturing and use. But last year, after Mugabe was sacked, Nangwangwa said he wants to offer people jobs. And one of those was to reopen an asbestos mine. So the previously closed asbestos mines are now reopened, and people have started working on the asbestos mines. So we see as a doctor who works in one of those mines was actually part and parcel of justifying why the mines have to be opened. And he said there's no evidence that chrysotile, the white asbestos, is dangerous. They actually they say white is right. So we're still sitting with a problem today. And I think my heartfelt disappointment is, as South Africans, we are sitting and we're not doing anything about it. Shouldn't we be opposing it? Shouldn't we be lobbying against it? Is there anything that we can do as South Africans? Because this is just next door to us, and it is going to affect us in one way or the other.
A very important point that we've also encountered is the more one strictly enforces certain preventive measures in one country, what happens is all the hazards get exported to another country or another part of the world where the legislation is weak, the enforcement is weak, and people are not empowered with the necessary knowledge to actually advocate for protection against these particular hazards. So this is one of the big problems in the context of globalization, that hazards are exported to other parts of the world where the controls are lax or do not even exist. So I think that's really another important lesson as well. Leslie?
So maybe just to carry on the theme of health, of health professionals' role in this. So there are many journals which publish on asbestos, and there have been a number of instances where papers have been published seemingly to exonerate chrysotile from health risks, and the authors don't declare that they are actually industry consultants. They have accepted money previously, or they'll say, well, this particular paper wasn't paid for by industry, but they don't say actually they on a retainer. So the generation of evidence on which we decide what's risky is really fraught, because the journal editors don't pay attention. And Kathleen Ruff spoke here last year, and she spoke about a problem where a particular journal, European Journal of Cancer, I think she spoke about, had published a paper by an industry consultant who didn't mention anything about conflict of interest. The paper was actually used in litigation in European context, and afterwards it was discovered he was an industry consultant. So I think it's, and the journal had to be pushed and eventually published a retraction. but we've seen that the bodies to cover our journals are actually incredibly weak. So when we see what the literature is, we have to understand that there's a context that's creating knowledge. And there's no such thing as value-free knowledge. It's absolutely the given fact. So we have to be quite critical in our work. So I think that's an additional challenge for us.
Sophie is nudging me to ask Rajan for a comment on this side. So Rajan,
Asbestos and men, Rajan.
and his experience with what's happening on that part of the world.
Well, in KZN, we don't experience either the large asbestos mines or the gold mines. In terms of mining related respiratory diseases, we are faced with the coal mine exposures. But the big problem for us, either in KZN or in neighboring provinces, is obviously the ex-mine worker problem. And I think the biggest concern that I have with ex-miners, we are on the border with Swaziland, with Mozambique, with the Eastern Cape, as well as pockets of ex-miners in KZN itself, is that we're doing far too little work to identify these workers. We're not reaching out. So I hear what Charles said and what Sophie said. How do we reach out to these workers? How are these benefits that have come through all these struggles going to actually reach out to these workers? And I think, as you've emphasized, Sophie, all of us sitting in this room, we need to figure out exactly how we put those mechanisms in place. I think up to now, the structures that have been implemented by either the MBOD or the Department of Health have hopelessly failed those workers. And for me, it's how do we move forward and make sure that
Very much. So I'm going to just call Shahida. To say something. Sophie mentioned that one of the big challenges is to put out the evidence there around the link between silica exposure and TB. To have it emphatically out there what those risks are and what work needs to be done, because as we know that there are a number of workers that are still potentially exposed to silica who may not necessarily benefit from this particular class action. So going forward, Shahida, would you like to perhaps comment on what you think we need to do around the kind of research questions perhaps that you think would be useful for us out there doing work to kind of pursue, considering you obviously, Shahida did her PhD thesis on TB in healthcare workers, and I'm sure there are some lessons there that perhaps we can use in taking our research forward.
Well, I just want to thank Sophie for the interesting talk.
Speak a little louder.
Both Sophie's being my boss and Mohammed is my cousin boss. I think as a clinician, as you know, the Western Cape is not a mining province, but certainly we are still seeing cases of both asbestos-related diseases as well as silicosis. There's a lot of ex-miners who trek between the Eastern Cape and Western Cape. So certainly I think one of our frustrations, is the lack of services and the lack of capacity to recognize these diseases. But I'm sure if you go to provinces such as the Eastern Cape, it's a lot more widespread problem. And precisely in the areas where the problem exists, there is no capacity to actually recognize. So I think that is an area that we really need to look at. The compensation system, which we're told might improve, but there is a frustration. Really looking at changes in the system in terms of how one can improve people's access to compensation, which we know from our mine workers, many of them just get hoisted onto the disability grant system, they can no longer work. So I think that would be very important. And then when we were working with Charles, I think I was struck when we were trying to put together the evidence for the link between TB and silica exposure. I was really struck by the fact that here we in this country, the first ILO conference on bleeding pneumoconiosis was held in our country. And yet there is such a limited body of research in making that link, in profiling the risk of mine workers going forward, you know, which mine workers are at greater risk. We still don't know who to put on to prophylaxis, for example. So there are very many clinical issues related to understanding the risk of our mine workers when we're looking after them going forward, particularly the risk of TB. And yeah, and I think it's just so under-researched. There's so little that's been done, despite this big burden that this country has been dealing with these types of problems.
Thanks very much. Is there anyone else who would like to say something? Mary's pointing at someone.
At the food.
At the food. She's hungry. Okay, then that gives me my cue then. So I just want to make some thank you remarks, obviously to our colleague and friend Sophie for making yourself available in this very busy and hectic schedule to come and share with us your reflections. I need to just grab something and to say thank you for all your contributions for today and for the past, and also in honor of you in terms of winning the President of Convocation Medal for 2017. I would like to also present this thank you to you on behalf of the head of department, to say how happy and honored we are that you have been awarded this medal, and that you reflect for us one of the excellent examples of the kind of scholar and graduate that our university produces, and we hope that there are many others who will come, who will follow in your footsteps. So thank you very much. And then to say, before I forget, that there are these books available for you to have a look at, as well as the exhibition. There are also some leaflets about Jock and his work and his contribution. You're welcome to take a copy of that. But I would also like to thank Pavla, Jock's wife, for allowing us to have this gathering, and also for sharing with us some of the pictures that she has had in her archives, which she has been able to share with us and which we are sharing with you today. So thank you to her, and we will obviously send a thank you note to her. Also to thank the head of department for supporting this event, both in spirit. He is unfortunately not here, Landon's overseas, and Andrea is acting, and I said I will communicate this to you, and also the food that we have has been supported by the department. And thank you to members of the division again for organizing and making this event possible. And then I need to grab the other bit of bunch of flowers, and to say a special thank you to Mary Miller. Mary has been with us since January.
August.
Yeah,
August. He was on sabbatical.
That's why I'm remembering when
you were back since August. Yeah.
And so we've always been trying to plot what can we do together. And the last time she came, she worked with me on my PhD, or doing the field work in St. Helena Bay on my PhD thesis.
Saldanha Bay.
Yeah, and St. Helena was next to, yes. Anyway, so this time we thought, okay, let's do something different. And so we thought of this idea of doing this tribute to Jock and to having this exhibition, and also to inviting Sophie and honoring Sophie. And so it's worked out amazingly well, and she did all the hard work and putting all of this together, getting all of these exhibits and working with others to make this a reality. So Mary, thank you for all And so we have really valued your contribution in the department, and you've obviously worked with various divisions to enhancing what you do. So thank you very much. So without further ado, that's it.
There is the CBD book going
Oh,
around
yeah.
if you need to sign for
Okay,
credits.
we'll leave it here.
It'll be here.
And please help yourself to some food on the right-hand side, and the exhibits are on your left-hand side. Also, special thank you to the National Institute for Occupational Health for sharing with us some of their posters which we have posted on today. So thank you to all of you for coming. Thank you.